Hello myopathy families, this is Pat, and this video is about time management and saving time with doing tube feedings. So this is applicable if you or a family member have a feeding tube into the stomach. So for example a gastrostomy tube or G-tube, that then you hook up a tube to that, and through that tube you flush in any of the nutrition or medications or things that you're giving through the feeding tube. And one of the things is that you want to look at things that will save you time, things that will be efficient for you, because if you or a family member have special needs and feeding tubes and those kinds of things, there's lots of things that take longer than they do for other folks, and you want to maximize your efficiency to free up your time and minimize your stress and all of that kind of thing. And one of the things that we're finding helpful for our feedings is that there's nutritional supplements that we're giving to our son and medications and such, and doing it through the feeding tube, and if every single day we have to take out all of the items, measure out all of the correct amounts each single day, and then administer them. It actually takes a fair amount of time every morning to, and sometimes in the morning you're half awake, etc. So what we're doing here, and I'm just showing in this short video, is the idea of having a bunch of little tiny containers that can be pre-filled, little tiny Tupperware or whatever plastic containers, and then we can set up once a week on the weekend, for example, and go through. In our particular case, we're using some nanogreens and some protein supplements and Miralax to help with bowel movements, and a multivitamin that would be difficult for our son to swallow by mouth, and for that we drop it into this mortar and pestle and we crush it up. If I can do this with one hand, here, so that you grind it up real fine. And then what we can do is just kind of go down the line and measure out the amounts to be given. Right? And we would go put all of this item in each and every one, all of this item in each and every one, all of the next. And that's good for things if you have a standard dosing that you're on for something. Again, I'm not recommending these particular items for you or your family, but rather talk to your physician and get whatever regimen makes sense for you. And then what we do is we would have, after adding everything, you can put these aside, close them up, stack them off to the side, clear up your counter space with the other stuff. And then these are also great for traveling if you have a few of these, if you're traveling someplace for a weekend, or if you have something that you need to give along the way. And then when it comes time to administering it, we bought a martini shaker especially for this purpose. And the nice thing about a martini shaker would be that it basically looks like a metal cup on this end. You would take whatever stuff you had, pour it on in, add in whatever you're mixing it with, whether that's water or milk or other things, or if there's any liquid medications that were not pre-made in there. And then this has holes in it for mixing it all together, so you would put that on, and then the cap, and then you shake it up. And as it swishes through the section with the holes, it makes all the dry powder stuff get mixed in really well with everything else. And then you would pop this off, draw up your syringe, and have your tube hooked up and flush your syringe on in. So again, maybe for some of you this idea will help you to save a few minutes in the morning as you're getting ready, or make things easier as you're traveling. As always, of course, discuss these options or what you're using, of course, with your healthcare providers. Anyway, I hope that helps, and be well, and wishing you all the best.